Hi everyone, and welcome back to our IPC in Action podcast. I'm Fran, one of the infection control nurses.
Hi everyone, welcome back. Thanks for listening. And I'm Jen. I'm Fran's colleague, one of the senior IPCNs in the team.
So, Jen and I, by the way, Merry Christmas.
Christmas. Merry Christmas, everyone.
Merry Christmas. It's coming up thick and fast. So Jen and I thought we would go into covering some of the, not lesser known per se, but some of the sort of, other respiratory
The slightly
viruses.
more obscure ones.
That's
that
the one.
when they come up, people are sometimes a little bit like, oh, what are we doing with this? Is this the same as COVID and flu, or are these different?
Exactly. And in a couple of years dominated by COVID, obviously, especially, but flu as well. And now norovirus, that we just thought we'd add a bit of almost background information to the other things that you might see coming through the doors and on the wards as well.
Winter's so much fun. It gives so many gifts.
Keeping us busy, that's for sure. So, we've got a couple to cover. So first of all, and you'll have to bear with me while I pronounce this correctly. So first of all, we have respiratory syncytial virus, otherwise known as RSV. I'm glad I got that.
And from here on in, we will refer to as RSV.
RSV. I'm not trying to say that word again. So RSV is just a common seasonal virus that affects both adults and children, and usually just causes mild cold-like symptoms, and they usually will recover in a week or two. Infants and older adults are more likely to develop serious RSV and might need hospitalisation or might increase their stay in hospital. So the symptoms of RSV are usually shown about 4 to 6 days after getting infected, and they include things like a runny nose, a decrease in appetite, coughing, sneezing, fever, wheezing, all of those typical respiratory things that we might expect. So the way it's transmitted, and I'm going to hand over to Jen for this.
So with respiratory viruses, it's sort of going back to that slightly controversial debate that really started with COVID over whether or not something is droplet or airborne transmitted.
Yeah.
And I mean, essentially, it almost doesn't necessarily really matter as long as we're being careful and cautious and carrying out those respiratory precautions that we know will protect us and protect other people.
Yes.
So it's the sort of the literature says that these viruses tends to be droplet, which is absolutely fine. We can almost call it whatever we want, as long as everybody is carrying out these precautions and being aware that when, for instance, you sneeze, those droplets might actually travel an increased distance. And there's an argument to say that they might remain, those smaller particles might remain airborne for a period of time. What that period of time is, we don't know.
No, exactly.
But it's just worth considering. So cover your face and your mucous membranes.
So on that, respiratory precautions are our main precautions for RSV. So respiratory precautions are including surgical mask. And then if you are able to assess the patient and say they need an AGP, then we would recommend using an FFP3 mask as well. Patients with RSV, if they are immunocompromised, they almost could potentially have prolonged shedding as well. So that's also something to bear in mind based on the timelines. Speaking of timelines, so the isolation period for these patients is shortly prior to and up to 7 days after onset. So for the duration of the respiratory symptoms, in particular a cough, we need to make sure that they're isolated in a side room for that time period. Also having our red signs on the door for respiratory precautions. Please let us know if you're a bit confused about those. They're in our most recent newsletter. So all in all, that's kind of RSV. It's another thing to just mention is that it's highly transmissible on paediatric wards. So we know that the paediatric ward here is majoritively side rooms, single rooms. That's
Thank goodness.
Great. But it's just something to be aware of with all these kids coming in over the winter period.
Yeah, we've seen a large number of peds coming in with RSV, and we have seen a few cases in our adult populations as well, particularly on the respiratory unit where people have those longer term respiratory conditions, meaning that they can be slightly more susceptible to picking up these viruses. And although a lot of them would be sort of considered along the lines of a common cold. They can still, well, I mean, as everyone knows, they can make you feel really rough.
Yeah.
But if you are at the either extremes of age, it can make you really quite poorly. So if your friends or neighbours have had a baby, don't kiss that baby, because we don't want to give them RSV.
Yeah, exactly. So yeah, all in all, it's not limited to any particular groups of people, but there are people that might be slightly higher risk of those virus of RSV. Sorry. Moving on.
So, moving on to another virus that we do tend to see, and it can cause a little bit of confusion, mostly I think because of its name. So we're not going to get too repetitive with this. We're going to talk about this next one, which is parainfluenza. After that, we're going to group a whole bunch of viruses together, because you see them a little bit less, and we're going to do the same thing with basically all of them when it comes to respiratory precautions, isolation requirements, and cleaning and so on. So parainfluenza is one of the most common causes of upper and lower respiratory tract disease, especially in young children. So it's similar to RSV, and there's a number of different types. There's types 1 to 4. Type 3 can be, again, this is going slightly more into detail than is required, but type 3 can be one of those quite virulent ones that can also make people really quite sick. It can cause bronchitis, bronchiolitis, and pneumonia. The symptoms are going to be the same with basically all of these, such as your normal cold-like symptoms, fever, runny nose, sneezing, coughing, etc., etc. Parainfluenza can be one of those nasty ones that can really affect either the extremes of age and or immunocompromised individuals and make them really quite sick. So those isolation requirements are the same as RSV, as are the cleaning requirements. So cleaning for all of these is our green universal wipes. They will kill all of those viruses. And we just want to make sure that especially any reusable equipment that's going into those rooms, such as observation machines, ECGs, bladder scanners, etc., are being thoroughly cleaned in between use, so that we're not taking an inadvertently contaminated object from patient to patient to patient.
Absolutely. So yeah, as Jen said, kind of grouping together the other 3 types of virus, just because they're very common with their symptoms, and they have a lot in common, let's say. So the other 3 that we have are adenovirus, rhinovirus, and then human metapneumovirus. So again, cough, fever,
Same symptoms.
Yeah, so they're also really important to try and get isolated inside rooms where you can. Again, same transmission as Jen was speaking about earlier with the droplets and respiratory secretions.
And possible a bit of airborne as well.
Yeah, exactly. So we're also recommending wearing your surgical masks in there as well. Again, same as RSV, it's shortly prior to and up to 7 days after onset that they need to be isolated for, and just for the duration of their respiratory symptoms, including the cough. So as that was a very quick roundup of the other 3, then we are also just going to do a very quick one on testing and what's required for testing. So to test for things like human metapneumovirus, parainfluenza, rhinovirus, adenovirus, then we need to be sending a full respiratory panel. These are only tested on Tuesdays and Thursdays, just something to bear in mind. If you're wanting a quick result over a weekend, it might not arrive until the Tuesday or even the Wednesday if it's done later on. So that's just something to consider. The other thing is that we have the option to send respiratory swabs, which test for COVID, flu, and for RSV. So that's a kind of in the meantime and will be tested daily. So again, just bear that in mind.
And it's definitely worth considering that you often wouldn't necessarily suspect that somebody had specifically parainfluenza or something like that. You would find it as an incidental finding running that respiratory panel. So it's worth considering that if you send a COVID, flu and RSV panel to the lab and it's all negative, but this patient continues to have these respiratory viral type symptoms, that it would be worth sending the full panel just to see exactly what is going on and if it can pick up one of those slightly less common.
Because then you're just covering all your bases,
Absolutely,
really, if that's
and
required.
doing the best thing for your patients as well.
Absolutely, yeah. So other precautions that you'll obviously hear us talk about all the time, just things to obviously prevent these from happening in the first place, and continued measures to help protect yourselves as well, visitors,
and
other
prevent
patients.
onward transmission of
Exactly,
these.
absolutely. So the big one, hand hygiene. So obviously washing your hands if you have any visible matter on your hands, but hand gelling using your 5 minutes of hand hygiene effectively. When a patient is discharged, if they've been in a side room or a bay, we need to be having an amber clean of that area, including the curtain change as well. Very
an amber clean
important.
does incorporate a curtain change.
Yeah.
You shouldn't really have to say and a curtain change, because
Yeah.
that is included within it. But I think sometimes it's definitely worth reiterating, just as a cover all your bases type of discussion with our domestic services.
Exactly. So obviously we know that we're very much aware of all the bed pressures at the moment, but these are really important that they get done, because, you know, the more that we do to prevent these things, then the better that, hopefully
better
from an IPC
outcomes.
point of view, better outcomes. Yeah.
And I mean, the
So-
quicker we can get these things contained, the quicker we can get areas
Exactly.
open and get patients better and on their way to going home or to their
because
onward.
believe it or not, we don't like closing areas, although sometimes it seems that we do it a lot.
We definitely
don't
don't get a kick out of it.
We just kind of have to. So, yeah.
I think the final points I wanted to mention was just swinging back slightly to RSV. There is a very new vaccination program going to be starting with RSV, and it's going to be looking at vaccinating peds, but also looking at the potential of vaccinating our older adult community to protect them from RSV, which is just an interesting thing to keep your ear to the ground on. And we have talked about lots of other viruses, but going back to our faves, COVID and flu, we're not in flu season yet, thank goodness. When we are, we're going to be going with FFP3 masks, risk assessing those visors if required for COVID and flu. So this is a change. So all of the other viruses that we mentioned, RSV, adenovirus, rhinovirus, parainfluenza, human metapneumovirus, we're doing surgical masks and FFP3 for any aerosol generating procedures. For COVID and flu, if it's suspected or confirmed, we're doing FFP3 masks straight away, please. Now, there is a chance that the advice will change. Just basically to make it a little bit more streamlined and easier for everyone. But currently, surgical masks for all other viruses, FFP3 for COVID and flu, please.
Yeah. So just keep your ear to the ground for that one. And obviously, any queries, please direct them at us, because we want to make sure that you are all safe in these winter months, because they are it's a long winter in terms of the things that we get coming through the doors. And
we want to protect ourselves as much as our patients.
Absolutely. And just keeping ourselves all healthy. So, please let us help you if you need it. Please,
And
check.
some of these are slightly, you don't see them or hear of them all that much. So just give us a shout. If you're not sure, give us a ring, drop us an email, whatever is your preferred method of communication.
Exactly. I know we're never expecting anyone to sort of know these things off the bat, because half the time, there are things that we hear of that we're like, oh, I don't know what that is. Just like, don't know, necessarily how to manage it. So please, get in contact with us.
So I think, I think we're probably about done.
Quick one today, maybe. I don't know.
A Christmas treat for you all, a quick one.
Merry Christmas from us. Merry Christmas. I hope you have a lovely time over
hope you get some time off.
Exactly, get some rest, and we will see you all in January.
We'll look forward to seeing you in the new year.
Exactly. So as usual, our contact numbers are extension 6122 for Gloucester and 3129 for Cheltenham. Or you can email us. Our group email is on the contact list on your emails. And Merry Christmas from the both of us and the rest of the team.
Thanks very much, everyone. Thank you for listening. Bye.